So my name is Harish Gupta, medical coder and process trainer for ambulatory surgery coding, and I am also the creator of Passport 21 free medical coding YouTube channel. So as all of you know, our intention is to help the people as much as possible. So without asking or without request by the people, we are providing the valuable information to the coders, which is very helpful for the medical coders, including updates about ICD-10 CPT, HICPICS, and also we are providing free AAPC webinar information, and also we are providing free jobs also. And these jobs are also spread over USA, UAE, and India. And today also we are going to have one session on how to pass CPC certification exam in 2024. So we have created one video in 2023, so which is most of the coders are happy with that video. With the motivation from that video, we are going to start how to pass CPC certification exam in 2024. So in this session, we are having Pulin from New Delhi. He is a CPC trainer and as well as he is a CPMA trainer. So he will provide trainings to UAE, India and USA students. So he is having nearly 10 years experience in training. So today he is going to explain us how to pass CPC certification exam in 2024. Yeah, Pulin.
Yeah, hello. Am I audible?
Yeah, yeah,
Everyone, please. Good
yeah.
morning. Yeah.
Yeah, can I
Okay.
stop my sharing?
Uh, okay, no problem. I should be sharing now. No problem. I will share my screen.
Yeah.
Yeah,
I will
so
stop my
that I
sharing.
can.
Yeah, start your sharing.
Okay. 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 I hope my screen is visible now. Are
Yeah,
you
yeah.
all okay? Okay,
Yeah, we
no
can see
problem.
Pulin.
Yeah, okay. So, as we all know, CPC stands for Certified Professional Coder. That is the examination taken by American Academy of Professional Coders, USA. And this examination is duration is 4 hours, and we have 100 multiple choice questions. So, in that, we have four choices: A, B, C, and D options. Out of that, we have to pick one correct option, and there is no negative marking, but passing percentage is 70 percentage. Okay, minimum 70 percentage somebody scores, then that will be considered as a pass. Below 70 percentage, even 1 percentage will not be considered as a pass. 69, that means it is not a pass. Okay. And this is open book exam. So approved books, you can see here three books they have given here, name of three books. AMS CPT Professional Edition, that is for the current procedural terminology that we will use for the procedure and services. And next you can see ICD 10 CM current year. Okay, International Classification of Disease 10th revisions, clinical modification. So this book we are using for the disease, illness, sign and symptom, and HCPCS level 2 will also be provided for supplies, injections type of things. So we have to use these three book, and we have to find out the answer. So basically we need to understand thorough understanding of the guidelines for all this. Okay, so that we can find out the correct answer quickly. Something you should be readily available having in your mind, then you will be able to act fast. So that is the preparation phase. Now the course. Okay, so course you can see here, they have given here the course content, that breakdown of 100 questions for CPC examination.
100
So medical
questions.
that.
Pulin, I think you can't scroll. You are not scrolling your screen. So we can see only up to the code book. Go little bit up.
Okay, but now I have changed now, breakdown of 100 question.
Okay,
Can
okay.
you see that?
No, we can't see that. So you can
No,
see
okay,
only up to the
okay.
code book.
Yeah, now.
Yeah, now it is fine. Yeah,
Okay, okay. There is means we have to press tab button. That is
yeah,
the
yeah.
thing.
No
Okay,
worries.
okay. So here you can see breakdown of 100 question they have provided. So total 100 question breakdown in this manner. So medical terminology, we have 4 questions. Okay, and anatomy also we have 4 questions. Compliance and regulations 3 questions. Then coding guidelines 7 questions. So coding guidelines means it is a ICD 10 CM or maybe CPT, both guideline they can ask. ICD 10 CM, this is pure ICD questions. Total number of questions 5. HICPICS level 2 3 questions. CPT they have given the series wise. So 10,000 means it is an integumentary series. We have 6 questions. 20,000 musculoskeletal 6 questions. 30,000 that is including respiratory and cardiovascular 6, total 6 means you can consider respiratory 3 and cardio 3. 40,000 that is digestive 6 questions again, and 50,000 series we have 3 chapters here: nervous urinary system, male genital system, and female genital system. Total of 6 questions. 60,000 series you can see here: nervous system, eye and ear, all these things are included in 60,000. Total of 6 questions. Then we have radiology code 6 questions, and pathology and laboratory 6 questions, and medicine 6 questions, and lastly it is a ENM 6 questions, and anesthesia 4 questions. Only 4 questions. Anesthesia is a comparatively easier section, and lastly it is a 10 cases. Okay, 10 cases means it is a lengthy question. Particularly most of them will be in the format of operative report. So these are the 10 questions. So total it will be making 100 in 4 hours. So this is about the structure of the CPC pattern you can consider by AAPC. So just miss, we need to prepare thoroughly about the guideline, how to find out the code, and what guideline in which circumstance we have to apply. All these things we have to understand. And then we can pass this certification. This certification exam is not too much difficult or not too much easy. With a little bit consistent effort, anyone can pass within 2 to 3 months. Okay, daily basis, per we have to prepare on a daily basis. Yeah. So any question now? I have already shown you the CPC paper structure. So if somebody has any question, they can ask. No problem.
So as I told you before, our intention is to help the coder, so you can clear all your doubts, whatever you are having the doubt. So anyway, we are going to put this video on our YouTube channel. So later also you can watch. So now you are having the chance to ask and clear all your doubts.
Yeah, related to CPC, you have any thing in your mind, you can just ask. No problem. You don't have to hesitate. Whatever comes to your mind about CPC, I will be happy to provide the best possible answer.
Whenever you want to write CPC exam, you need to have the dedication. So basically, it is not that much easy. It is not that much difficult. So basically, it is like based on your skills. So within short duration or within stipulated duration, you need to write this exam. Only if you are familiar with your like I said 10 CM and CPT books, you can write properly. So for CPC exam, there is no need for live coding also. If you are familiar with your code books, you can write it very easily, and you need to practice more.
Yes. Yes,
So
exactly. CPC is just a basic certification, just to provide that somebody, if CPC is passed, that means that person is knowing the guidelines and is able to code the chart. That is the only thing. Okay, that is not the proof of any expertise, but just a basic certification in medical coding.
and also you need to remember CPC is the basic certification for medical coding. So for example, particular in India, so if you are having the CPC certification, you can do your job like lifelong. So there is no restriction on that. We have more than 30 certifications from AAPC, but each and every coder needs basic certification CPC. So if you are having the CPC certification, you are able to survive your whole life without any problems. Yeah, go ahead, guys. So basically, this is not like it is
Yeah,
not
this
going
is
to.
interactive session, so you need to speak something. You need to speak out so that everyone can know. Means if somebody has that query, that can be answered.
Yeah, yeah.
Okay.
So directly you are going to help others. Why means we are going to put this video on a YouTube. So if your question is problem for others also, so they can know because of you.
Yes, exactly.
Hi, this is Vijay.
Yeah, go ahead.
I'm going to ask about the question pattern. Is it MCQ or objective type also there?
What is difference between MCQ and objective?
Multiple choice questions and objective type. We have to select the answer
Yeah.
by our own rules.
There will be four options provided: A, B, C, and D. Okay, that I already told you now. Then A, B, C, D options will be provided. Out of that, we have to select any one correct answer. Okay, we have to find out, apply all the guideline, and find out that correct option. And there is no negative marking. Okay, don't worry about negative marking. There is no negative marking.
You mean to say only MCQ, multiple choice questions,
Yes.
no
Yes.
objective.
Yeah.
Okay, fine.
No, I would like to know from you what is the difference between MCQ and objective. That is what is I also
Uh,
want to know
uh,
eagerly.
in MCQ, options will be there. In
Okay,
objective type, there are no options. So we have to give answer by our own.
okay, that is objective.
Yeah, yeah, objective. Fill
Okay,
in the blank kind of thing. We have to answer.
okay,
That's it.
okay.
They'll
Fill
not
in
give
the
any
blank.
multiple choice
Okay,
question.
fill in the blank will
I
not be.
myself am not get. That is why I'm asking.
Yeah, yeah. Okay, so you can see here the what is given here breakdown of 100 questions, and they have not mentioned MCQ, but it is MCQ. Okay, there is not written here, but so far it is MCQ only, and they have not changed anything so far. Till today, it is same thing.
Yeah,
Okay, fine.
basically, like Sunil, we have one question here. So fill in the blanks. Someone is telling that we have five questions for fill in the blanks.
Okay. So that is also not a problem. I don't know people are why worrying about. See, filling in the blank also will be the same. Suppose somebody asks you, what is your name? Okay, this is a question. What is your name? Question mark. That is one way, and then they will give A, B, C, D option. Okay, and there is another way also. That is your name is blank. And again, this same the time passes, they will be revising the questions. So questions cannot be repeated. Okay. So questions will
That
be
someone,
definitely formulated every in the every month exam.
that someone said me, my friend said me ki in nowadays they are asking subjective question. Maybe they will ask subjective question.
Guys, if it is
See,
subjective
subjective or
also, that is not at all difficult. Why means everything is provided in your CPT book and
yeah,
different
yeah,
CM book. You no need to go outside
Ops,
for your mind. Just you need to
options
familiarize
will
with
be
No,
those
there.
books.
yes, sir, I know. But they told me you have to write your own answer for some question.
So
No, no,
actually,
no.
we
That
just
is
yeah. Go ahead, please. Go ahead.
yeah, no, that is not in CPC. Okay, that is option is in some questions in CCS certification. That is another certification. Okay, in that it is
Oh,
allow miss it is required to miss seven question. We have to answer like that. We have to find out and we have to give the answer. There is no option, but it that is in CCS. Okay,
okay, okay,
CPC it is not there. CPC you will
oh,
have ABCD options.
okay, sir. Only objective, only
Yeah,
MCQ type.
yeah. That
Okay,
you what you are telling that is right, but that is certified coding specialist. That is by AHIMA. That in that exam, seven questions will be like that. Okay,
okay, sir. Can you tell me about fee structure? How much I have to spend on this exam?
which one?
For
Fee
CPT,
structure.
yeah, fee structure question.
Yes, yes, yes.
So training
Okay,
as
fee
well as
structure. Yeah. Okay. So CPC certification exam, I will write down here. Suppose CPC training fee. Okay, training fee will be varying. Okay, means between 10 to some institute will be charging 50, 25 also. Okay, so that is depends on institute and the place. Then AAPC charges. Okay, AAPC charges for CPC exam. So whenever somebody wants to write the CPC exam, then the first thing comes, that is membership. Okay, so without membership, no one can write the exam. So AAC membership charges, that is 205 USD. Okay,
Okay.
and then AAPC exam charge. So exam charge, there are one attempt also available. One attempt, that is
Yes.
$430. Okay, and
Okay.
if it is two attempt, then it will be $530. Okay, if it
Okay.
is two attempt, then this will be 530. Okay, so total you can see $735, and there will be a equalization levy added to that. Okay, so
Okay.
equalization levy, including that, how much, that I will tell you. Uh, 735 into 1.0204. So total of 750 you can consider. Total $750 will be the charge for two attempts.
Okay. Around 50 or 60, 55 or 60,000 in Indian rupees.
yeah, correct.
Yeah, we have to, 65 you can consider, because suppose let's say I'm multiplying by 87. Okay, so yeah,
Okay.
65, around 65, approximately rupees 65,000.
So this like
Okay.
APC certification exam fee is common for everyone. But the thing which from your side you can control is choosing the institute. So as our trainer told,
Yes, sir.
some institutes will take nearly 30,000 for training only, not for certification. Some institutes will take, so like they will take 10,000. Some institute 15,000. So it is everything is depends on the institute. So based
Sir,
on that,
how much are you charging for this session?
so
Uh,
currently
for
there will
further
be,
session?
yeah, it is not for demo session, it is for educate the medical coder. So if you are interested, you can contact us personally. So if you are interested to join in the CPC training, so you can contact us
Yes, sir.
personally, we will know the fee. So this is session is not for the like training. So this is basically
Yes, yes.
like education session to educate the coders who are named to medical coding.
Yes, sir. Sir,
So
online session timing you can explain?
sorry.
If I want to join your session further, can you explain the timing? When can I join?
Yeah, of course, of course. Are you in our Passport 21 WhatsApp group?
No, 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 sir.
So just send your mobile number to our. Otherwise,
Timing, timing wise, he's having some query. So online, if you opt for the online training, then timing will be decided by all of the group. Okay, whatever we can conclude, that timing will be there. But obviously, there will be in morning or in the evening, because so many persons are interested for training while they are doing some job. Okay, so that is the
Okay, sir.
general scenario, but it depends on the means person to person also. Okay.
Yes, sir. Actually, I'm currently working in medical coding field, so I
Okay.
have to take some time to join the classes.
Okay. Good.
so
Uh,
basically, na, so we will follow the students' timings only. Whenever you are having the sufficient
Yeah.
time to join, we will follow your timing. Not based on our timing, we will follow your timing. So it will
Yeah.
be
okay,
Obviously.
sir.
Yeah.
majority students' timing.
Okay, sir. Thank you, sir.
Majority students preferable time. So Pulin, we have one more doubt. So what about
Okay.
2024 E&M changes? Are they going to experience 24 exam changes like E&M changes in this year?
See, 2024 ENM changes, whatever they are means circulated, those questions will be asked from the mostly from the March onwards.
Okay.
Okay, for the January, February, they are not going to ask that much questions relating to new guidelines.
Okay.
Okay, because they also know that this is something new and the CPC is a basic certification, so they will most probably they will not be asking on the new guideline.
Okay. So you
I
are
think some people might have joined which are already doing a job in medical coding. So if you have any doubt, you can just open up, ask any doubt relating to CPC.
so in order to write CPC examination, one thing is mandatory. So you need to become AAPC member. Then only you can write the CPC exam.
Yeah, APC membership. If somebody buys, then only this exam voucher will come into the cart. Okay. Otherwise, directly somebody clicks on exam voucher. That is simply the APC site will be denied. Okay. They will
No,
not allow that.
yeah, directly if you click on CPC exam voucher, na, directly it will ask in order to
Yeah,
join
directly.
this
I think
training, it will
they
ask
will add
membership
the
first.
membership charge. Yeah, directly they will add the membership and then so this amount. Okay, yeah, I forgot to tell you one thing. Two attempt, that means it should be consumed in 1 year. Okay, suppose somebody buys two attempt voucher on 26th January, so it will be valid till next 26th January 2025, and that up to that time, if somebody fails the first attempt, then up to that means 26th January 2025, second attempt will be allowed. That is the thing. Okay, APC. And one attempt, there is no such thing. Okay, one attempt means it is passes or fails, that all the things are over.
So one thing you need to remember that if it is fill in the blanks also, there is no problem with your knowledge. Just you don't need to use your outside of your brain. Just you need to use your CPC like IC10CM and CPT books only.
Yeah, exactly. Okay, they change anything that will not impact. If you are prepared thoroughly and if you are well prepared, then there is no need to worry all those things. Okay, because we have been provided all the four options, and so there is means we have to just use the books. Okay, properly we have to use CPT and ICD books, then it is sufficient.
One second. Yeah, here is the
Then there will be no problem in passing CPC certification in first attempt.
so yeah, that is the thing. So frankly speaking, I wrote my exam without any training. So I have prepared for 2 months rigorously without any training. So I have used all my CPT books only. I have not used any outside material. I have used my ICD-10 CM book and 2023 previous CPT book. So using CPT book and these books only I have passed my exam. Even they have provided few examples also here. So using these examples also you can write. For example, you don't know why 26 modifier used. So if you see your CPT book here, they have provided 20 a physician providing diagnostic or therapeutic radiology services, ultrasound or nuclear medicine services in a hospital would add modifier 26 to report professional component. So here physician is providing the service, not the facility. So here we need to use professional component which is 26 modifier. So for example, if you see here multiple surgeon modifier. So for example, you don't know why do we use 62 modifier. So if you are familiar with your CPT book, so you can write easily. So we will use 62 modifier for multiple surgeons. So first surgeon and second surgeon. So here we have unlisted procedures or service. So if we encounter any type of unlisted procedure or service, you are going to watch this section and you can write. For example, if you get in the exam that will you append any modifier to unlisted procedure or not. So if you follow these guidelines, you will write easily stating that you will not append any modifier to unlisted procedure or service. So your question is, will you append any modifier to unlisted procedure? Options are so like 25 modifier, 56 modifier or 58 modifier, and fourth option is no modifier for unlisted procedure. So here we will select fourth option, which is no modifier for unlisted procedure. But for in order to know that one, you need to check your CPT book. Yeah.
Yeah, we have one question from Nazia Sultana. That she asked that, sir, my membership is till February 2024, so I have to write exam in same month. Okay, no, it is not necessary that you write exam in February itself, because if your 1 year limit extends beyond February 2024, then you need to buy the membership. Okay, you have to just buy the membership, and then up to that 1 year limit, you can use your second attempt or first attempt, whatever. Okay, Nazia, are you there or left? I think she is there, or maybe.
Yeah, it may be useful for other people also, the answer.
Yeah, yeah.
Go ahead, guys. You, now it is your turn. You can clear any of your doubts.
Okay,
So,
just looked this message in the chat, and I see some blank question related to messages that we have already addressed. Okay, and what about ENM guideline changes? That is also addressed. Okay, nothing to worry about changes. Okay, because the CPC examination will focus only on the fundamentals. Okay, if you know the fundamentals and basics, then there will be no problem. Okay, there is nothing to worry about guideline change. You, if you know how to read the book, how to properly means read the book, then there is no problem, because they will be providing the latest book. Okay, suppose somebody goes in 2024, then they will be providing 2024 books, not 2023. So that will be automatically taken care if you know how to use the book. Yeah, any more question? Guys, please ask questions so that you can know, and other persons also can know. Okay, it's same doubt.
Chawla sir, do you have any doubt?
No, I'm good, sir. Thank you very much.
Pulin, I told you, na, we have one contact with one doctor from Chandigarh.
Yes, yes, yes. I just guessed that
Yeah,
sir is also, yeah, same, I think. Yeah.
Thank you very much, sir. Very nice tutorial, sir.
yeah.
Very informative.
Yeah, guys, so here is we are having Dr. Chawla from Chandigarh. So he is already a professionally a doctor, but even though he is a doctor, he is trying to write CCC exam. He already completed without any training. He has completed his training. So just he followed only guides like IC10 CM book and CPT book. Professionally, he is a doctor and he is currently practicing.
Plus, I followed your YouTube channel, sir. Fast Coder 21.
Thank you, sir. Thank you very much. But
I did that.
yeah, I am asking these students to take motivation from you.
Certainly.
Yeah, yeah. So you need to have the dedication that at any cost I need to pass CPC exam, and we are here to help anytime. Like for example, if you have any complexity while preparing for your CPC exam, just mention in our comment section of any one of our YouTube video. We will try to create one video for that session. And also currently we are having nearly 30 videos related to CPC exam. So daily you can go there and you can watch all those videos. So those all are created by myself using the YouTube live session. So using those videos, so many people are passed CPC exam. One example is Chawla sir, and we have more students. If you check the comments on those videos, you can understand. So any doubt, Geeta, Anlin?
Yeah, Anlin has put one question. For non-life science graduates, which one is good to take, CCS or CPC for future job opportunity? Okay, please understand one thing. There is no good or best or like that. Okay, it depends on what is your means thinking. Okay, CCS and CPS both are the basic certification. CCS certification is by AHIMA. Okay, and CPC certification is by AAPC. And AAPC's marketing is more than AHIMA. So AHIMA also you can take if you wish. Okay, no problem. Both are value wise both are same, but if you pass CPC, then you have to miss, you have kind of inpatient opportunity also will be there. Okay, in some companies inpatient people will be asking only for the CCS certification. So but that is a little bit, you have to be rigorously studying, because in CCS you will have to study ICD 10 PCS book also. Okay, so study wise, it is little bit more intensive than CPC.
And one more thing you need to remember that, so if you are a non-life science background, CCS is not at all useful for you. So you
Yeah,
need
yeah,
to remember
exactly.
here, CPC is for outpatient coders. Okay, CCS is for inpatient coders. As a fresher, directly you can't go to CCS certification. So this is very difficult. So it is even US and UAE also people are following. If they want to enter into medical coding, first of all they need to write CPC certification. Then only they will get the job. Then after few months experience, they will write for CCS examination. So just you need to remember, CPC is the basic certification in order to enter into medical coding. So CPC anyone can write. So there is no restriction on that. So everything based on your skills and your like dedication towards that exam.
Yeah, and in CCS we already discussed. Now some questions will be subjective. Okay, you will not provided that options. So you will have to find out whatever by reading the question, and you have to answer. Okay, so that is in CCS, not in CPC. CPC everything will be ABCD options will be given in every single question.
Yeah. If you check the AAPC CPC exam answer key, na, just you need to choose one answer out of four. So that filling the blanks also, I think it is not implemented now. Correct, Pulin?
I have never encountered anyone approaching me that that person has got fill in the blank so far.
Yeah,
Okay.
that is the thing. So why mean our Pulin is always training the people, and every month his students are writing the exam. So that's why he will get the latest updates for CPC exam.
They are likely to offer 2024 onwards, sir.
Yeah, I think, sir. So it is mostly from March or May. Even a CCS exam also they are going to do some changes, but they are going to implement from May 2024.
Okay.
So they are also having, I think, like financial year like that those things. So based on those, currently they are not implemented. I think in future they may implement those things.
Yeah, in future, I think they may implement ebook option also. Okay, maybe right now they are providing the books. Okay, and in future they may introduce the option of ebooks. That means we have to use the computer-based books and
Yeah, yeah.
find out the answer.
Yeah, there you no need to take your physical books to APC center directly. You need to use this e-book. So basically, pulling this along with Codify, they are providing already e-books.
Yeah,
So
yeah,
if you
yes.
purchase Codify, so they are providing e-books. But in US,
Okay.
most of the people are using e-books only. So I have
Uh,
discussed with few of my friends. So most of the people using e-books only.
yeah, but in the examination they are not allowing to use ebooks in
No,
US
they will
also.
provide along with their exam. I think so.
Maybe, but I have not encountered
Yeah,
anyone
so
because
far this is
one.
also new
Yeah.
implementation, not at all started. But the
Okay,
thing is
okay.
that these people who are trying to write CCC exam must be familiar with your physical copy as well as how to set using the e-books also.
Yeah, yeah. So that is the my preference will be to use the physical book, because in the real examination they will be providing, they will be allowing the physical book. Okay.
Yeah,
Right now there is no option for ebook, so definitely we have to just make ourselves familiarize with the physical copy of the book.
exactly.
Okay. Yeah. One more difference in CPC in India, they will be providing you the original books. Okay. In the India, wherever you take. the CPC examination, the books, original books will be provided at the center. Okay, the candidate will not have to carry. But in CCS examination, the candidate has to carry the original books. Okay, so that is also one of the differences.
Yeah.
So you may have to get it at on rent also. Okay, then you can take the books in CCS examination center and like that. Okay.
For CPC, exam center will provide the CPC books for you. Like
Yeah, in India it is at the center the books will be provided.
so, any doubt, guys? Geeta, Adil, Anlin, Kavya, Krishna Kumari, Nafiha, Najia, Puli, sorry, Rajeshwari, Sindhu, Srikant, Subha Bhaskar, Umshi, Kavuri. So you can ask any doubt related to medical coding. Not a problem. Not only for like CPC. So always our intent is to help the medical coder as much as possible. And for example, if you are going for any type of interview, you can watch our YouTube channel. So I have already created interview Q&A for all the specialties, including inpatient surgery, HCC, renal management, anesthesia, and ED also. We have so many videos, guys. Just you need to have the interest. You need to choose whatever you want to learn. That is the thing.
Okay, Kavya has asked one question. Time will be sufficient, sir. 4 hours. Okay, time will be sufficient. Yes, obviously sufficient. If you are well prepared, if you know how to use the guideline, then 4 hours is sufficient. Okay, even if you are miss excellent, then you can save 15 minutes also.
So time will be depends on you, guys. Why means how familiar you are using your coding book.
Yes.
If you are familiar with your coding books, directly you can go there and you can write. So if you are not familiar with your code book, no, it will take time. And so obviously you need to use and you need to spend more time on that. So one important thing here is that whenever you write CPC exam, just you need to write the questions which you are confident, 100% confident. Then you need to
Okay,
attempt for
there is
the
one more question. Sindhu asked, what is expected salary for certified freshers? Yeah, Haris, can you please answer this?
yeah.
Miss, it depends on local
Yeah,
location also.
Sindhu, yeah,
Okay,
that
yeah.
is a good question basically. So, whenever you want to coming into medical coding, you know, so this is not separate from other fields. So, completely it is depends on you only. So, one means, for example, if you take companies are giving 15 to minimum 15,000. You see, it is based on the company. So, not based on you or the thing. So, basically nowadays there is a huge competition for medical coding. Even BPT and physiotherapy and so doctors also planning into coming into medical coding. So if you are having or if your knowledge is equivalent to doctor, na you will get more salary. So if it is they will check your anatomy skills also. So overall you can think that minimum 15,000 you will get. So that is also based on the company. Very small companies will give you only 10,000. So if you are confident and if you are attends multiple interviews, you will get the good idea about how the interview process will be. So if you join any type of MNC, minimum you will get 18,000 MNC, not for small companies.
Okay, next question is asked by Subha Bhaskar. How about job in UAE for freshers?
So guys, one thing you need to remember. So if you are in India, so if you want to work in UAE or USA, you must be in that country. So you need to go to hospital and you need to set your coding job. So multiple times you need to go to the hospitals and you need to inquire with the HRs of each and every hospital. So it is not like from India. If you want to go and if you want to settle in abroad, you need to go there and you need to search. From India, you can't apply for these jobs. Even nowadays, companies are also telling. So these jobs are for example, I will provide US jobs. but those jobs are only for US residents, not for Indian residents. So that is the very important thing you need to remember. So if you want to apply for UAE or USA job, you need to be stay in USA or UAE. So you must be a resident of those countries. So from India you can't apply, even they will not consider your your CV. It will send also.
Okay, next question by Nafisa. Does the option will be less than four options? No, not at all. Okay, if they introduce kind of true or false, then that is different thing. But so far it is not not encountered. Okay, less than four options? No, not at all. Okay, you will be provided four options: A, B, C, D. Then Sindhu has also asked a question, which better, pharma industry or medical coding? Again, it depends only on you. Okay, you will have to decide what is better. Okay, because we cannot say that medical coding is good and pharma industry is not like that. Okay, just miss. We cannot comment on it.
Yeah, correct. So it is completely based on your interest. Why means these pharma people will come to medical coding. Medical coding people will go to pharma industry. So that you need to decide.
What is exam fee for CPC exam? Okay, so that already we have discussed. I think. Okay, the fee in general it is for two attempts. It will be around 65,000.
Guys,
Okay.
if this session disconnects, you can join again if you have any doubts. Continue. Sir.
Yeah, I think people are now opening up. They are just putting messages in chat. So I am just very eager. Okay, some other question by Kavya. How to solve case study questions in CPC exam? Okay, this is very good question. Okay, how to solve case studies? Case studies, I already told you that the questions will be in the operative report format. Most of the questions. Okay, not all the questions. So you need to be familiar with the keyword. If you know the keyword concept, then it will be very easy question. Okay, depending on the length of the question, so many people get panic. Okay, but you don't have to be panic. If you know the keyword concept, then these case study questions will also be very easy questions. Okay, so that is focused in the training also.
Yeah. So that is the basic training for each and every institute will teach you in that way only. In that way only. So
Yeah. Okay, first thing, panic management is very important. If you miss just by looking at the length of the questions, you should not get fearful. Okay.
so if you have more than 20 lines also, you need to concentrate on one or two lines. Yeah. Go ahead, Pulin. You are asking. You are answering for Kavya, na?
Yeah. So case study question in CPC examination is not at all difficult one. Okay, just be prepared to face the question by using the tips and techniques. Yeah, any question, guys, you can ask in chat also, no problem. But you can speak also. Okay, if you want to speak, then that is option is also available in this section.
So we will wait for 15 more minutes. So if you are having, if you don't have any doubts, we will conclude this one. So if you feel that I want to learn this topic or something different topic, just you need to mention on the any one of our video comment section, so that we will try to make video on that. So Kavya, do you want to speak out? Nafiha, Asher, Dhanesh.
Accordingly, I think one has to look for the job
Yeah, for
somewhere.
that you have two options, sir. Anyway, you are not worried about that. So basically, so for CPCA we have two options. One is your regular experience. So if you are having the 2 years experience, automatically you will get the experience certificate, and you will reply you will apply for CPCA removal. Second one is,
Okay.
I think you can use practic code also. APC
Yes,
practic
practic code is
you know.
another option.
Yeah, that also very useful. So if you want to learn coding, so there I think someone told from USA nearly you need to clear like and you need to attempt 600 scenarios.
Yes, it is about 600, sir.
Yeah, yeah. So if you clear all those scenarios and you need to write the final exam.
Okay.
But that is paid option, okay?
Yeah, yeah,
But
paid
they are
option. That is not
charging,
free.
yeah,
Yeah, correct.
Yeah,
charging
you have to
something.
buy. You have to buy practic code.
Yeah, exactly. So that is the option. So but anyway,
Yeah,
you
that is one of the options.
yeah, anyway you can't work as a coder now. So but I think sir for you you can try for CDI. So why
Beg your
means
pardon, sir?
in CDI
Which
na
one?
most of the MBBS doctors, the companies are taking most of the MBBS doctors. CDI, clinical documentation improvement.
CDI and medical reviewer, they are always asking about the medical certification
Exactly.
graduation.
MBBS
They are
also.
already, yeah.
Okay, okay, okay. I'll look into that, sir.
Yeah,
I
yeah.
didn't know.
So in our channel, I have one video related to that, sir. So it is like basic one video.
Clinical document
Yeah,
improvement,
improvement.
that is
I think
certification.
it is so based on like basics of CDA, clinical documentation improvement. So if you want, I will
Okay.
send one video. So I will forward that one. So no need to.
Kindly do that, sir. I'll be
Yeah, yeah,
grateful.
sure, sure. So why means you can do CDA easily compared to this coding, and
Okay.
more value also for that CDA.
Okay. I'll take that path, sir.
Yeah, yeah, yeah. What do you think, sir? CDA is good path,
Yes,
na?
yes, exactly. CDI is more appropriate for doctor candidates because they will be hired in that position accordingly. Okay, and right now there are some companies also offering getting some projects on CDI, so that is a really good option.
Yeah.
Oh,
Uh,
thank you. Thank you very much, sir. Thank
yeah.
you.
Sir, but frankly speaking, India little bit less jobs for CDA, but in UAE and US we have more jobs. In CDA also, na, you have like outpatient CDA and inpatient CDA. In US, you
I,
have
s-
more opportunities. But
I'll be
that,
grateful if you can forward that video.
yeah, sure, sir, no worries.
Thank you very much, sir.
Yeah. Directly, why means if you see the job post, few companies are asking directly MBBS qualification. They are not asking
Okay.
CPC.
I see. Okay, okay,
Yeah.
okay.
Yeah, like that. So if I find any job like that, na, I will forward to you.
Thank you, sir. Thank you very much.
So, Prashant, do you have any doubt, Prashant? You can speak now.